Hey, hello everyone, welcome to the channel 14 Shades of MBBS. Today we are going to discuss a beautiful chapter in ophthalmology is orbital cellulitis. It is a diseases of the orbit. Firstly, we have to know the definition of an orbital cellulitis. Like it is an inflammation. There is an inflammation of the tissues. Orbital tissue is known as orbital cellulitis. What causes an orbital cellulitis? Maybe there are two direct causes and indirect causes. Direct is any perforation to the perforation or trauma to the eyeball, any perforated object, or any infection in the eyeball, or any septic procedures that may lead to the infection of the eyeball. Firstly is directly. Next, indirectly is surrounding structures of the orbit, which mean directly leading to the orbital cellulitis. What are the surrounding structures? Nose. From nose, sinusitis. Any nasal sinus infection which may lead to the orbital cellulitis, and also sometimes retained foreign body in the eye may also lead to the cellulitis. Now, the cellulitis are two types: preseptal cellulitis and orbital cellulitis. What is septa? That divides the orbital cellulitis into two types. The orbital septum is known as a membrane that acts as an anterior border, extends from the orbital rim and the skull. When we take the skull, the rim is the boundary of an orbit where the eyeball lodges into it. The orbital septum, it extends from the rim of the orbit to the eyelids. It's a membrane. So now the preseptum cellulitis is the just anterior to the orbital septum, mostly involving the lids, and orbital cellulitis is the term behind the orbital septum, which may involve or may not involve the lids. Okay, we have differentiated preseptal cellulitis and orbital cellulitis. Now, preseptal cellulitis mostly is the swelling of the eyelids, and there is a redness, erythema, and there is chemosis, congestion. They may be associated with the conjunctival discharge, and also there is no affected of ocular movements or visual function is normal, and also there is no proptosis. Basically, the treatment is no, as there is an inflammation, so non-steroidal anti-inflammatory drugs will be prescribed, and the resolution is quick and complete. Coming to orbital cellulitis, it is very extensive swelling of the lids, and there is a chemosis, also proptosis, protrusion of the eyeball, and also there is severe congestion, and there is a restriction of the movements, and also there is a impairment of visual function. Fundus of the eyeball is difficult to examine. They may be normal. On examination, the fundus may be appear normal, or there may be engorgement of veins, and optic neuritis may be developed and later into optic atrophy. The abscess also points somewhere of the skin of the lids and the orbital margins also. Sometimes panophthalmitis may supervene, which may causes the severe damage, may lead to extinction into the meninges, and also brain may lead to purulent meningitis. And this purulent meningitis may lead to the cerebral abscess, indirectly or directly may lead to the thrombosis of the cavernous sinus. So, we knew the process, how the orbital septum may lead to the orbital cellulitis, may lead to this brain and cause the meningitis. Now, what are the organisms may lead to this? Firstly, staphylococcus and streptococcus gram positive. They may be Haemophilus influenza or Pseudomonas or sometimes E. coli. Okay, these are the infections. Where these infections are prevalent, mostly immunocompromised on diabetic patients, where there is most infectious or more attacking group, more effective group. In diabetic people, the infection may be also caused by fungal organisms like Aspergillus and mucor. So there is this we have done with the organisms. Then how can we classify? We just divided preseptal and orbital cellulitis. Now, how is the classification, staging? is by the modified Chandler staging system. Stage 1 is the preseptal cellulitis. Stage 2 is the inflammatory orbital edema. Stage 3 is a subperiosteal abscess. Stage 4 is orbital abscess. Stage 5 is cavernous sinus thrombosis. Okay, we have staged it. According to staging, we can take any CT scan to observe the extension of the soft tissue involvement and orbit involvement, and we can take the blood samples. But intravenous treatment should be started with broad spectrum antibiotics before the results have been out, and anti-inflammatory drugs immediately should be instituted. Next, a CT or an MRI should be done to know the spread and extent of the infection, and the presence of localized abscess may necessary prolonged treatment or should be drainage of the pus. Hope you liked it. This is the voiceover thing. Next time I'll try to write a notes. Thank you for encouraging, and we need your feedback. Thank you so much. Stay safe. Be happy. Thank you for watching this video. Thank you.